Hi, Chris. Thank you so much for having me on your show this morning. I really appreciate it. Yes, so my name is Prescott, and I am part of the Kansas City End of Life organization. And one of our goals is to make sure that people in our community understand the importance of writing down your end of life care plan. A lot of people don't like to talk about it, but it's really important. Um, Sure, I can give you a couple of examples. And yes, Chris, it is free. You can download the forms on Kansas. You can download them, print them, fill them out, and then just have notary, kind of signed off on that. And that's it's legal. And make sure that you share it with your physicians, or if you go in for a hospital care or anything like that. So an example I'll give is personal. My grandmother had many heart issues, surgeries and that sort of thing, and her foot started hurting. Long story short, her circulation was interfering with her leg, and it had to be amputated. My grandmother otherwise was of sound mind and body. She had two daughters, my mother and my aunt, who felt that she should have her leg amputated. My grandmother did not want that to happen. But my mother and my aunt were trying to have the doctor say that my grandmother didn't understand and was not able to make those decisions. Long story short, her leg was amputated, but one of the concerns was that due to her health, she wouldn't be able to make it through the surgery, which she did. However, she did pass away in her sleep a couple nights later. So I remember the stress, the fear, and the guilt of my mother and her sister trying to make this decision because they had never had that conversation before, and felt that they knew what was better for my grandmother, when in reality it is her decision. And so what happens a lot of times, if these decisions are written down, aren't documented, or at least not even spoken about, then it does decrease the chances of, quality of life, and in the end, a peaceful death. Yes. So I go around with my team to different areas of the city, and educate folks on the importance, the negatives of what could happen. So another scenario is someone who feels like they want to keep their loved one alive at all costs. So that could be a feeding tube. That could be going into ICU, when really all you wanted to do is just have your pain managed with either hospice or palliative care, and pass away. Because a lot of people feel that when they are in treatment into the hospital, that they're going to miraculously come home in the condition that they were in before they went into the hospital, when many times they end up having to go into long-term care, skilled nursing care, rather than just coming home and enjoying life the way that it is. Yes, Chris, it is also something to consider someone that is living with a cognitive decline or Alzheimer's or dementia. How do you want that to be? I've spoken with families where someone was progressing rather rapidly through dementia. In the middle of it, they were diagnosed with cancer, a very aggressive form of cancer. So do I go ahead and continue with a treatment plan that is going to be extremely painful, knowing what the quality of life will be for someone that is progressing through a disease like Alzheimer's or ALS or other kinds of diseases that could happen. So we want to make sure that everyone is aware, that everyone fills out this form and has this conversation. There is no legislation that mandates that this happens, although you can have conversations with your physicians and the hospital system. So feel free to reach out to me. I can come and speak to your family, to your church, to your reading group, and I can even help you to come up with a way on how to bring up the subject and complete these forms. Thank you, Chris, and I am hoping that we will increase our numbers of having our advance directives written down and documented. Thank you.